How to detect early stages of thoracic outlet syndrome. My name is Dr. Turchaninov. I'm founder of Science Massage Institute located in Phoenix, Arizona. Everybody knows about thoracic outlet syndrome as a very debilitating pathology, but the early stages of thoracic outlet syndrome called anterior scalene muscle syndrome. And anterior scalene muscle syndrome in somatic medicine has nickname silent killer. Why is that? Because anterior scalene muscle syndrome actually responsible for all somatic abnormalities, starting from the headache to the arm, forearm, hand dysfunction, numbness, tingling on the pinky or carpal tunnel, to the chest pain, to the middle back pain. All these somatic abnormalities may be a result of anterior scalene muscle syndrome, which mildly irritate brachial plexus and trigger all these somatic abnormalities, which can be misleading because then therapists treating abnormalities, but their consequence, they're not origin of the problem. From that point of view, detection of early stages of thoracic outlet, informant of anterior scalene muscle syndrome, is a vital piece of data. Different orthopedic and neurological tests have different validity. Some have 12–20%. There is Wartenburg test, which is developed by German physician Wartenburg, and its test is 100% informative, confirming or not confirming tension in anterior scalene muscle and possible irritation of brachial plexus and anterior neck. So what we will do today, we will review how to use Wartenburg test for the early detection of tension in anterior scalene muscle, and if the test is positive, therapists do not have professional rights to work on any abnormalities on the neck, upper and middle back, or upper shoulder until Wartenburg tests become negative. In such case, you address the cause and the consequence, inform further treatment of rotator cuff injury, carpal tunnel, or middle back pain. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you and see you in the future. What are the symptoms of anterior scalene muscle involvement? It is variety, that's why it's called silent killer. You may have patients with headache, you may have patients with tingling or numbness going down to the arm in radial, medial, ulnar nerve distribution. You may have patients with carpal tunnel, rotator cuff injury, with the chest pain, with the middle back pain. All of that in the form of loss of function, muscle cramping, tingling, numbness, burning sensation, decrease in the range of motion. All of these symptoms which you actually see in patients on a daily basis, the cause of them can be in the completely different part of the body, in the anterior scalene muscle tension, which irritate brachial plexus and mimic somatic abnormality, while the cause of it, neurological aspect. That's what value of Wartenburg test. Okay, let's look on the application of Wartenburg test. And first, let's discuss anatomical landmarks. Dotted line is the upper border of the clavicle. The dashed line is the posterior edge of sternocleidomastoid muscle. And what you see here, two solid lines, are edges of anterior scalene muscle. Anterior scalene muscle is guard of the brachial plexus. So what we would like to do, we would like to test how much pressure anterior scalene muscle actually elicits on the brachial plexus, and we're doing that by additionally stressing brachial plexus. The test becomes positive if application of pressure in this point create syndromes or symptoms down to the arm, to the middle back, to the head, or patient have acute pain with mild application of the pressure. You will make test positive if you will use a lot of pressure. So it is very mild to moderate application of the pressure. However, the correct placement allows you to get proper reading. So what you would like to do, you would like to place your thumb following the clavicle, upper border of the clavicle. When you are in the correct place, you will feel pulsation of subclavian artery. The pulsation of subclavian artery means that you own anterior scalenum muscle. What you need to do right now, you gently apply pressure forward and then roll it under the clavicle. In this position, you're stressing anterior scalenum muscle, which stresses brachial plexus, and if the brachial plexus is irritated, you will get positive reading down to the arm, to the neck, to the head, depending what part of brachial plexus is compromised. So this is very simple but extremely efficient test because it allows you to rule in or rule out neurological aspects of somatic abnormalities. You eliminate tension in anterior scalenum muscle with 2-3 sessions of anterior scalenum muscle protocol, you have big chance that actual symptoms patient come will go away, or you address the symptoms with another couple sessions, and that gives you stable clinical results. So that is extremely valuable test, and its application gives therapist 100% information about further treatment strategy. Please consider to use them in your daily practice, which will help you dramatically to address abnormality in early stages and then work on the cause of the problem rather than running for the consequence. Do you use Wartenburg test in your daily practice? If yes, leave your comments below. Thank you for watching, and let's work together to bring your practice to the level of medical massage application. Hope to see you next time. Bye.